what we're going to do now is we're going to start with Alexis, and we're going to do her, she can tell us about her research. She has some interactive activities for us. I have a short bio for Alexis, and then you can jump in. Alexis is the director of palliative care at Navian. She's a board-certified nurse practitioner with nearly 6 years of clinical experience and is deeply committed to advancing access to quality palliative care across diverse communities. She earned both her Bachelor of Nursing and her Master's of Nursing from California State University at Long Beach, and recently completed her Doctor of Nursing practice in 2021. So she embraced the opportunity to relocate to Hawaii, and maybe I left something out there. Alexis is passionate about community education, reducing stigma around palliative care, and ensuring that patients and families receive the support they deserve. So thank you very much, Alexis, and take it away.
Thank you, Jeanette, and thank you, Hope, for having me. Excited to share my research with you guys. I think we can all say, like, working in healthcare, burnout is very frequently talked about. I feel like even, more so since the pandemic. It almost feels to me like burnout is just like, yeah, it's something like we know and we constantly hear about, but is that problem always being addressed? Is it ever on the forefront of our minds? Working in this field, we're trained to recognize burnout, and, our patient's family unit. We all recognize our work puts us at increased risk for this, yet we continue to see healthcare shortages and turnover. When I started my doctoral project, anecdotally, I can say that, I decided to write what I know. But on a more serious note, we enter this field because we care for this population. We don't enter it because it's just, an easy fit into our lives. Like we're extremely passionate about what we do. And so I wanted to ensure, as I move through my career and stay in this field, how do I ensure that as people join and, dip their toes into this, how do we ensure that these people can stay? Because we truly need healthcare workers to care for this population. Again, why do we need to retain healthcare workers for this population? It is expected that by 2050, the proportion of adults over 60 is going to double. That's according to the WHO. Burnout rates in palliative care and hospice can reach up to 67%. That's it's significant, and then within our state, we currently see a significant number of healthcare shortages, which is projected to worsen over the next couple of decades. The recent pandemic, the nursing workforce survey reported 23% of respondents had considered leaving healthcare, with 15% reported had leaving the industry already. A 2021 report from the state of Hawaii nursing illustrated that there is a projected 300 to 400 nurse shortage. And then in 2022, the Hawaii Physician Workforce Assessment Project noted a significant shortage of physicians, with approximately a shortage of 589 full-time physician. And then with non-physician healthcare positions that were open, there was an increase of 10% from 2019 to 17% in 2022. Burnout, affects more than just our patients. We're noticing that there's more increased risk for medication errors, there's less compassion, and their overall quality of care that is being given to the patients. This, like I said, doesn't only affect our patients, it affects our internal health, with increased prevalence of irritability, headaches, sleep problems. And then within sleep problems, there's poor sleep quality, poor sleep duration, greater daytime dysfunction, greater sleep latency. We also see psychological effects, with the study finding approximately 12.9% of male physicians and 21.4% of female physicians with high levels of burnout. They exhibited patterns consistent with alcohol abuse or dependence. So this is not just affecting our patients, like the reach of burnout is quite large, and it's not just the patient, it's not just us, but it's to the healthcare organization, the healthcare system altogether. In one report, nursing turnover can cost up to 3 times a nurse salary for the organization. It's financially burdensome to the healthcare system. So when I thought about what I wanted to do to address burnout, because burnout isn't just caused by one single thing. I can't change the nature of our work because the nature of our work is definitely heavy, and it's heavy with us. I can't necessarily, change the entire culture of our healthcare system. So I wanted to lean into what could I empower my colleagues, my staff, and just see what I can give them as a resource to help reduce burnout. Mindfulness programs have been found to be beneficial for this demographic of healthcare, finding improved strength renewal and ability to focus on the present. So my project goals were to address burnout for the growing concern experiencing within this healthcare system, recognizing its impact on both the clinician well-being and patient outcomes. Wanting to reduce overall burnout levels and implement a structured evidence-based mindfulness program. Mindfulness programs have demonstrated benefits in improving sleep, reduced fatigue, enhanced memory, building resilience, and supporting physical well-being as well. So what I decided to do was do a mixed method quality improvement project using one group doing a pre-test and post-test. The intervention that I landed on was the 8-week Palouse mindfulness program, which I can get to in just a few minutes here. And I incorporated both clinical staff as well as non-clinical personnel, and this was all on a voluntary basis. So my pre-test and post-test assessment tool was the Maslach Burnout Inventory. And I opted for the Health and Human Services Survey instead of specifically for clinicians or social workers, because I was going to incorporate a variety of different backgrounds. And then I used demographic descriptive statistics to be able to describe that. Overall, I didn't have a very large sample size. I started out with 13 participants, and I ended up with 11. Their ages ranged from mid-20s to mid-50s. One had their doctorate, a couple had their master's, and the rest had bachelor's degrees. Significantly more females than males. So that definitely skewed my statistics a lot. But that being said, this is the mindfulness program that I opted to implement. Founded by John Kabat-Zinn. He worked at University of Massachusetts, implemented this at their medical school. So this is just a free program. I have the resource or his link to the website and my resources, but this is available to anyone. It doesn't cause no cost. There's incredible amount of resources. So all of the things that I have embedded into my presentation here are everything is what I have found on his websites. There's a lot of alternatives, lots of great resources about why we find it hard to meditate. I mean, there's mindful eating on there as well. But this, like I said, includes meditations, videos, readings, and then some yoga. The first couple weeks, they really focus on a couple of different meditations. The first is the body scan. Second is the sitting. And then weeks 3 and 4 are more geared toward yoga. Their recommended yoga session is over half an hour, I believe. And that wasn't something that I was going to ask my participants to be included in. So I opted for the 10-minute one, which is one that I have chosen for us as well. Weeks 5, 6, and 7 all focus on different additional types of mindfulness. Week 5 is about turning inward towards our emotions and pain. And that is one that we will be doing. The week 6 is kind of like a mountain and lake meditation, kind of viewing yourself as a mountain or a lake. And then loving kindness, which is, giving love to yourself. And then a walking one. So kind of embedding in, a little bit of movement into meditation. And then week 8, it allowed participants to say, these are everything that we have given you. Please, this is an opportunity to find what works really well for you and create something meaningful for you and that you feel like you could incorporate. These were my results. In the emotional exhaustion subscale, we can see that they're most statistically significant. There was a reduction in feeling fatigued when they first get up in the morning. You can see there's varying levels of statistical significance there, but feeling used up at the end of the day, just feeling burned out from work, feeling frustrated, feeling like they're at the end of the rope, and feeling emotionally drained. within depersonalization, there was a significant reduction in feeling emotionally hardened by the job, improved empathy and reduced cynicism towards recipients. Within personal accomplishment, there was a significant reduction in, how easily they're able to understand either whether it's the recipients or just their coworkers, and feeling excited about coming to their job, reflecting sense of competence and professional fulfillment. The open-ended questions that my participants responded with is having difficulty finding the time. This is something I think we can all agree with, is we just find time to take care, finding difficulties taking care of ourselves. It was really hard to remember to complete the activities. And to help with this, I did create a website that was dedicated to these participants. They didn't have to go to the main website and have to search for resources. So I did dedicate a website for them. This is something that the program actually talks about. It's just, we rarely invest time to simply stop or pause, thinking, how many times have we sat there and doom scrolled, or how often do we just mindlessly watch TV? So it's, just kind of shifting our mind, is it truly that we're finding a hard time, or is it just, hey, can we consciously dedicate just 5 minutes out of our day to really focus inward and take care of ourselves? The second challenge is really difficult time quieting the mind. They said, my mind constantly wanders. There's managing just competing demands of being a human being in life, their work, somewhere in school, some had just really complex home lives. Palouse or Shapiro and Shapiro actually talk about, we're so used to our minds just running constantly, it's like a monkey sweeping branch to branch and thought to thought. And that's just, it's a natural tendency. And mindfulness in itself is not about stopping all of those thoughts. It's recognizing hey, I have thoughts that are going to be flowing through, and it's totally normal. It's abnormal if we wouldn't have a constant slew of thoughts coming through our mind. These challenges were common and expected, and there were so many resources that could help explain or walk through why we would be feeling these things. Some of the benefits that they reported, they just felt just very relaxed and just meaningful reduction in their anxiety levels. They're able to gain perspective and focus. Some actually reported that one of the first weeks of meditation, that they were actually falling asleep while doing the meditation. And I had listened to a podcast actually just about sleep in general, and how we need to start deregulating our system for sleep. And this was actually one of the recommended tools to help, deregulate our nervous system and help us get ready for sleep. So many reported improved sleep quality. They found that the combination of both the yoga and then mindfulness was really helpful and just improving their focus and helped me relax and get to sleep. Trescott noted improvements in perceived stress levels, psychological, physical well-being, sleep, and resilience, which was consistent with what I had seen with my participants. The recommendations that I had for this practice site is, how can I take what these participants had said was really beneficial, and how can I implement this into the culture? I spoke to how can I, as I move through this career in this field, how do I ensure that I can potentially change the culture at wherever I'm working? So I had opted to and try to incorporate that at the practice site, include this in education modules. I can speak to every healthcare place that I worked. We get a module on, did you know that you're at risk for burnout? Did you know that you need to take care of yourself? But I never got a resource at the end of those trainings. It was always just check the box that you got information on how to reduce burnout, but there was never this is something that has been scientifically studied and this has been proven helpful. Why don't you try it? The only other resource I think I got was counseling or something like that. So I wanted, this is what I wanted to give them, something tangible that they could try, and then offer just kind of drop-in visits, hey, we're going to start an 8-week session. Feel free to drop in at any time. When I thought not just implementing this within whatever practice site or any type of healthcare setting, widening that lens a little bit. When it comes to policies, I wanted to incorporate, at the institution, incorporate burnout assessments and employee satisfaction surveys. In the 12 years I've been a nurse, I think I've only had a satisfaction survey that included a burnout assessment once, maybe twice. And it's really understanding as an organization, like, burnout is something that is very important. I work with a colleague who says no mission. I know I'm going to butcher it, but if we don't have our healthcare team here, we can't take care of the patients. So how do we ensure as an organization that we retain our staff? Develop policies addressing workplace stressors, invest in resiliency training and coping strategy and other health promotion programs. And then even at a local legislator level, incorporate fair productivity goals and employment packages as well. What I wanted to do with further research, I enjoyed this entire project. As difficult as it was very rewarding to get a lot of the feedback each week from these participants and just say how beneficial it was. Some were a little bit more hesitant. I had one participant say it was leaps and bounds how much this reduced their physical pain. They also incorporated it with acupuncture as well, but they were saying, like, during these sessions that they felt this whole level of relaxation and peace that they had never experienced in previous acupuncture sessions before. So I wanted to conduct further research and with larger sample size and a more diverse participant background as well. I would love to implement this as a mobile application and with material access and reminders. I also want to, like I said, want to conduct more robust studies so that we can determine generalizability as well. This is one of the first of our two activities. Like I said, this was a core practice from week 5, integrating, instead of avoiding difficult feelings, we should gently embrace them. So if you guys want to, I can walk you through this. So if everyone is ready, let's bring ourselves to the moment, ground ourselves physically and sensing into the support provided. We can either be sitting on the ground, on a chair, feel the floor beneath our feet or whatever we're sitting on or whatever we're doing. Now let's gently direct our full attention to our breathing for a full few breaths. Feeling each in-breath and out-breath. What would you call this feeling that you are having? Notice, are you feeling anything right now? Do you feel anger? Do you feel fear, sadness, anxiousness, feeling of rushing? Is this, for example, instead of saying like, I am angry or I am anxious, is there something in me that is feeling that way? I'm noticing me that something is feeling this way. This gives me the more feeling and more room to move within these feelings. You don't identify yourself with this, it is just knowing something within you is feeling this way. Just being more aware of what is happening right now. Now see if you notice there's anywhere in your body that might have a physical reaction to this. Is this tightness in your shoulders, in your chest? Is this an uneasy feeling in your stomach? Is this pressure? Is this tension, heat, tightness anywhere? If you can't necessarily find a specific place, is there a general unease about you? Allowing what you're noticing to just be there. Simply acknowledge it, letting your awareness gently rest there, and allow it to just sit there. Can you soften your reaction to this? Can we take some long, deep breaths? See if you can be with it the same way that you would be with it if you were comforting a pet or a child that you loved who's in distress. Almost imagine yourself embracing yourself. You might even place a hand over where you might physically be feeling that tension. Is that on your heart, on your belly. Experience this with kindness, recognizing that it would be difficult or painful or challenging for anybody to be holding this within themselves. And gently embrace yourself with compassion. This act is softening and allowing. Softening your reaction to whatever feeling you're having. Allowing that reaction to just be there, while knowing that allowing it to be there doesn't mean that you like it. Just simply acknowledging that this is what you're feeling right now. Without trying to push the difficult feeling away, see if somewhere along your life where things were generally okay, maybe good, could be something, someone you are grateful for, could be a loved one, could be a pet, could be past, present, maybe an achievement, past, present, a hobby that gives you pleasure or satisfaction. Or is it quality or strength that you have that you might be rightfully proud for? Could be simply recalling a smile or a kind word that you had for someone recently or in the past. In this step, we want to broaden our awareness, kind of panning out with wide angle lens, including what you're both grateful for and along with what you're currently having difficulties with. We're creating space for both the pleasant and the unpleasant, not necessarily pushing out the difficult or clinging to the present, but shifting and saying, including perspective, that our entire body and all of its sensations can have very conflicting things exist at the same time. With a few deep breaths, we can bring ourselves back to our awareness and our surrounding. Just letting attention to where the world resides outside, taking in sights, sounds, and sensations. If everyone is ready, we can move on with some chair yoga.
Okay.
There might be.
Begin by finding a gentle lift in the heart. So one of the things I love about Yoga with Adrian community is that there's this focus on three things, and it's you just do your best. You show up and you do your best. We try to be authentic, give ourselves permission to be ourselves, really just show up as our true self. And the last one, find what feels good. So keep those three things in mind throughout this practice today. So you might be leaning back in your chair, lifting your heart. You might be sitting up nice and tall. So to each his own for sure. Lifting up through the chest. Then take a second, trust yourself, trust me, trust the video, and take a deep breath in and close your eyes. And then exhale, relax your shoulders down. Again, with the eyes closed, take a deep breath in, just kind of going inward a little bit, checking in. And exhale, relax your shoulders. And then one more time, just like that, deep breath in. Fill up with air. And exhale, relax your shoulders down. Give yourself permission here to enjoy this time, to tend to yourself, little TLC. Go ahead and put away the day thus far. Allow the future agenda to be put on hold and do your best to just allow yourself to be really, really present, really in the moment. Okay, a little goes a long way. So from here, we're gonna keep nice, long, deep breaths going. So best you can, nice, full breaths. Just notice how that goes. Sometimes you'll forget and you'll want to come back to it with a deep breath in. And then a big exhale to relax the shoulders. All right, so keep coming back to that breath. Keep noticing where you're at with your conscious breathing. Now, with the hands resting gently on the tops of the legs, you can also grab your chair, the arms of the chair, the outer edge of the chair. We're gonna inhale, lift the chest even more, open up through the front body and lift the chin just slightly. And then exhale, rounding through the spine. Think cat-cow here, chin to chest. Again, you can close your eyes if you're feeling groovy. Inhale, open, lift up through your front body. Opening through the chest, lifting the chin, and then exhale, rounding through chin to chest. Weight of the head drops down and over. Do two more. Inhale, open. Think long puppy belly in the front. Feel that stretch as you expand, and then exhale, round. Spinal flex, so good. Inhale, do one more. Inhale, lifting, lengthening, smiling perhaps. And then exhale, chin to chest. Navel draws back here, and this time we're gonna pause. Breathing deep, feeling that awesome stretch in the back of the neck here, allowing the shoulders to go ahead and round forward, the fingertips to be soft and relaxed. Take a deep breath in here, feel this awesome stretch in the back body. And then on an exhale, keep the chin tucking into the chest and just slowly begin to roll it up. Head over heart, heart over pelvis. Great, take a deep breath in. And exhale, relaxing the shoulders down, 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 long in the neck. Sweet, take the fingertips forward and then plug the shoulders into socket. Again, take the fingertips forward, reach, and then plug the shoulders back into socket. Then we'll take one of my faves, thriller arms, fingertips down, keep plugging the shoulders in. And you will already start to feel this nice stretch through the forearm here. Spread the fingertips. Try to keep a lift up through your chest. Breathing deep here. All right, let's flow with the breath. So bringing the wrists together here. We're gonna open up through the chest, start to stretch the pectorals as we inhale. Keep the fingers down, open the arms super wide. Exhale, bring them back to center. The arm is going to get tired here, so stick with it, just a few. Inhale, opening up through the chest, lifting the heart. Maybe the pinkies start to draw back a little bit more, maybe not. And back to center. And then one more, inhale, open. This is that Titanic moment, that Kate Winslet moment I'm always talking about. Inhale, exhale. Great, stick with it. Flip the palms, press, 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 press. I'm going to take a moment here. If you need a little more, you can bring one hand to the fingers for a deeper stretch. And then open it up. Inhale, lift the heart, stretch. Exhale, bring the thumbs together. Ooh, inhale, open, spread the fingertips. Exhale, close. Are you breathing? Inhale, open. Last time. And exhale, close. This time, hook the thumbs together and inhale, reach for the sky. Wu-Tang. Inhale, lifting and lengthening through all four sides of the torso. Big breath in. As you exhale, tilt gently to the right. Gentle side body stretch. Inhale the center, smile. Exhale, tilt to the left, gentle side body stretch. So focusing on the sensation over the shape. As always, inhale, reach. And exhale should feel awesome as you rain the fingertips down. Keep the heart open, lifted, and just take a second to notice how you feel. Awesome work. So this time we're going to take the fingertips forward, plug the shoulders in, eagle arms. Right arm comes underneath the left arm. And we wrap the palms. Maybe they touch. Another option is to just keep them like this, like hiya, like this. Or maybe you wrap around Garandasana. Now keep the shoulders plugged in. Inhale, lift the elbows. Eagle arms. Exhale, rounding through the spine, chin to chest, just like the spinal flex from before. Inhale, rise up strong, lengthen through the side body, and exhale, release, chin to chest. Awesome, inhale, one more. And exhale, chin to chest. Great, we're gonna unravel the arms. Inhale, open, big flying V here. Pinkies are forward, thumbs are back. And exhale, bend the elbows, slight back bend here if you like, cactus arms. Great, inhale to reach up. And exhale, once again, rain it down and just notice how you feel. Whew. Awesome. Great, fingertips reach forward. Plug the shoulders in. Left arm underneath the right this time, or whichever one you did before, you're gonna switch it. Here we go. Inhale, lift the elbows. Exhale, chin to chest, rounding through the spine. Inhale, eagle arms, lift you up. And exhale, chin to chest. And one more, you got it. Inhale. And exhale, chin to chest. Great. Slowly unravel the arms. Send the fingertips up high to the sky. Pinkies forward, thumbs back. Big breath. Then exhale, bend the elbows. Thumbs back, pinkies forward. Cactus arms. Ooh, yes. Inhale, reach for the sky. Exhale, rain it down. Awesome. So we're going to finish off with a twist. Should feel really yummy. So there's different variations of this, of course. We're going to start nice and simple by just taking the left hand to the outer edge of the right thigh, and then slowly, starting from the base of the spine up, beginning to open up through the sides. Now, different variations. You can use your arm on the chair. You can bring one hand behind. So there are ways to get a little more out of this, but I also just recommend you keep it small to start. Just kind of understanding and remembering that a little goes a long way. Take one more deep breath in. Inhale, lift and lengthen here. And then exhale, release, come back to the center. Take it to the other side. So twists are really great for the spine, but they're also really great energetically because you get a chance to Benji, everybody. You get a chance to lift your heart, and then on the exhale, choose to let go of that which no longer serves you. It's a detox, right? So again, inhale, lift your heart, and on the exhale, maybe you quietly say to yourself, I let go of that which just simply doesn't serve me. Wherever you are, take one more deep breath in. And exhale, release. Inhale in. Exhale, release. Benji the dog, everyone. Bring the palms together at the heart, Anjali Mudra. And take a moment to appreciate yourself. Appreciate your body. And we'll take one more deep breath in together and gently bow the head to the hands. So we finish practice by bowing to the best and most beautiful version of ourselves. And yes, we acknowledge that in one another. So I acknowledge you, the light in me bows to the light in you. We'll take a deep breath in, exhale, let it go. Perfect, Benji. Then inhale, lift your chin, lift your gaze. Check out Benji below my chair. Perfect. Just in time for the big ending. We bring the thumbs to the third eye today. May we always see the truth. Then drop the fingertips to the lips. May we always speak the truth. And finally, my friends, to the heart. May we always feel it. Thanks for sharing your practice with me. Take good care. Namaste.
Thank you. That's all I've got for you guys today. I hope you guys got something out of taking a moment to just care for ourselves. I think it is very important. I can speak to my personal practice that I always say, do as I say, not as I do. And I'm definitely reminded, though I've been, doing this PowerPoint and I know my research in and out, I definitely need reminders that I have to stop and take care of myself. And I specifically chose that feeling mindfulness moment. Just, it's so often that within our work, our day-to-day lives, that we feel a certain way. And I love this saying that I'd heard from a therapist before, is like, two conflicting things can be present and true at the same time. And I love that specific mindfulness, that we are not our emotions. We could be anxious, we could be sad, but we are someone, your phrase, we are someone that has this feeling. We are not this, we're not embodying those emotions. And for me, it's always a good reminder to stop and pause. And for me, it was very nice to stop and pause today. So thank you guys all for joining me. I just have some references if you guys want references.
Great. Thank you very much, Alexis. And we can share those references with people as well.
Yes, most definitely. I'm happy to share my PowerPoint with you.
Great. Well, thank you so much, Alexis, for making time to talk with us.